Glaucoma is an eye disease that affects this situation at the back of your eye that enables you to see called optic nerve. It doesn't occur all of a sudden, but it begins slowly by damaging this optic nerve starting from the side and moving on until it damages the whole optic nerve, leading to an irreversible loss of vision, particularly if care is not taken. Hi, I'm Dr. Harun, an optometrist here to help you care for your eyes and protect your vision for life. So if you're new to this channel, feel free to subscribe so that you don't miss out future videos that may help protect your eyes. Let's get into the video. So what causes glaucoma? Well, there are different causes of glaucoma, but it's most commonly related to increase in eye pressure. Here is how it happens. Naturally, your eye produces a fluid called aqueous humor. This fluid is supposed to leave the eye after it does its work. But when your eyes produce this fluid in excess, or that the channel through which this fluid drains out of the eye gets narrower or even completely blocked, this fluid will then accumulate in your eye, leading to increase in eye pressure, which then slowly starts damaging your optic nerve. I always prefer describing this like an inflated balloon. Now, if you keep pushing air into the balloon, the part that is the wick, which is usually here at the back, is what stretches out the most and bursts due to too much pressure. The same happens inside your eyes, but the part that is usually affected inside your eyes is this part of the optic nerve. I know you could wonder, what may make my eyes to produce this fluid in excess? Or what may make this drainage angle to become narrower or even completely blocked in the first place? Well, here is something that you need to know about glaucoma. Glaucoma isn't always something easy to explain. Actually, there's something still not clearly understood about what exactly causes glaucoma or what exactly causes the eye pressure inside your eyes to increase. But it's most commonly related to some factors, and that's why the cause of glaucoma is divided into primary and secondary cause. When we say primary from the word primary, it means that there is no known underlying cause for the rise in eye pressure which result in glaucoma, or for the exact cause of glaucoma, but it's believed to be obviously related to some factors such as age. As we grow older, our body structures start to weaken. The same happens inside our eyes. The drainage angles start to weaken as we grow older, especially from 40 years and above. And that slows down how fast the fluid drains out of our eyes, which result in increase in eye pressure that may result in glaucoma. Likewise, several global studies, including Genome Research Foundation, found that people with a family history of glaucoma, that is to say, if your mother, your father, your sibling, or someone closely related to you have glaucoma, you are up to 4 to 9 times more likely to develop glaucoma than one without family history. And that shows that even though it's not fully understood, genetics play a huge role. The secondary cause of glaucoma means the glaucoma results from other eye diseases or eye conditions, such as eye inflammations like uveitis, eye injuries, eye tumor, or even taking too much of steroids, especially steroid eye drops, because it was found that too much use of steroid eye drops can increase your eye pressure, which may result in glaucoma over time. And that's why it's always important, if you have any of this condition, to visit an eye doctor to confirm you are safe from increasing eye pressure, which may likely result in glaucoma due to your conditions. So that is what exactly is glaucoma and what really causes glaucoma. I hope that helps. If you don't have glaucoma, you want to know the 5 proven ways you can prevent yourself from glaucoma. I made a video about that. You can take it here. And I will also put the link to it in the description below. Thank you so much for watching. If you have any question, feel free to ask me in the comment section. Otherwise, see you in the next video. And until then, take care of your eyes. If you got value in this video, make sure you subscribe to the channel so that you don't miss out future videos that help protect your eyes. See you next.